Oh, today I will be talking about coronary artery disease and what effects it has on the heart. First, I'll start out by discussing some anatomy of the heart, and then we'll go through the blood flow and break down talk about the different diseases that can occur from coronary artery disease or CAD. First off, I'll start off by discussing the anatomy of the heart. As we all know, the heart is a muscle, and it's like all other muscles. It needs oxygen, enriched blood to function effectively. And if it's deprived of the blood, the heart, like any other muscle, it suffers or the blood flow is decreased. The heart will starve or it will eventually die. If you have a deficiency or a low amount of blood flow, or where a part where the flow isn't going, it's what is considered to be called ischemia. The more extreme case can develop into a heart attack or a myocardial infarction, which means that the flow of blood has been so impaired that the heart is literally starving for blood or that it is dying. The heart is divided into four chambers. You have two upper and two lower parts. The two upper parts chamber are referred to as the right atrium and the left atrium, and the two lower chambers are considered the right ventricle and the left ventricle. Those are very important in discussing the way the blood flows. Now I'm going to give you just a little brief on the way the blood flows in a normal heart. It first enters the superior vena cava into the right atrium of the heart. Then the right atrium contracts or pumps the blood through the tricuspid valve and into the right ventricle. The right ventricle then pumps blood through the pulmonary artery into your lungs. In the lungs, you have tiny blood vessels called capillaries. They absorb the carbon dioxide from the blood and replace it with oxygen. Oxygenated blood then flows through the pulmonary vein into the left atrium. The pulmonary artery is the only artery that has deoxygenated blood, and the pulmonary vein is the only vein in your body that has oxygenated blood. After it's oxygenated, the blood then pumps through the mitral valve and into the left ventricle. The left side of the heart contracts the strongest to send the blood out to the left ventricle. Now we're going back up. And through the aortic arch, it's on its way to the parts of the body. Blood would then move through the arteries, then through the capillaries, and return to the veins. The deoxygenated blood would then return to the heart, and this cycle repeats itself over and over again. First, talking about the aorta, it has two arteries, which one, a right and a left one, that supplies the heart with an enormous amount of blood. You have your right coronary artery and your left coronary artery. And the right coronary artery supplies the right side, and the left supplies the left side. Also, you have the aorta divides into what you call carotid arteries. These are the arteries that give the flow of blood to the brain. You have your right and your left one. Now, if these are to become blocked, your carotid arteries are to become blocked, then you are threatening a stroke. Now we will discuss some symptoms of CAD. The first step is to recognize that something's wrong and then move on. You first have the rapid or the fast heartbeat, the pounding heartbeat, shortness of breath, the pain or pressure that's located in the center of the chest, sometimes spreading to the arms, the back, or the jaw. I've had some people say that it's like they're having a toothache. You know, they refer to a toothache. Sometimes you have swelling of the legs, faint spells, nausea, and vomiting. these symptoms are very apparent, but you also have risk factors that leads or like precursors or preconditions that leads you to having CAD, like hypertension, hyperlipidemia, which is high cholesterol. And when we're saying high cholesterol, we're speaking on the bad LDL. You have a high fat content in your diet, excess weight and diabetes, smoking, your advanced age, family history, lack of exercise, excessive alcohol use. These are just some of the things that can lead to coronary artery disease. First, I'm going to start just giving you a brief talk about hypertension. Hypertension is elevated blood pressure. No matter how mildly elevated, is likely to result in coronary artery disease. It is one of the body's earliest warning systems. Your doctor will tell you you have hypertension if your top number, or what we consider your systolic number, you have a top number and a bottom number. Your bottom is your diastolic. If your systolic number is greater than 140 and your bottom number is greater than 90, you have high blood pressure or hypertension. The good thing is hypertension is treatable, but ignoring it can cause very serious trouble. Trouble comes in different forms. First off, it could be coronary artery disease itself. Secondly, it could be congestive heart failure, which means that the heart is overworked and therefore weak. And thirdly, is the stroke. If high blood pressure is treated aggressively and not ignored, the risk of coronary artery disease, congestive heart failure, or a stroke is greatly decreased. Now let's talk briefly about the first trouble, which is congestive heart failure, which simply means that the heart is not pumping effectively because it is weak. It cannot push blood out of itself and in an efficient way and has to work harder. In CHF, the heart must pump more frequently and harder to supply blood and oxygen to the brain. This condition leads to a heart that is overworked and enlarged. Untreated, congestive heart failure eventually leads to complete heart failure. Stroke is the next thing that I'm going to touch on. You have the carotid arteries that I mentioned earlier that supply your brain with blood. And if the blood pressure in those carotid arteries is high, the artery walls become weakened and start to close, reducing the oxygen flow to the brain. The decrease of blood flow and oxygen to the brain leads to many strokes, or TIAs, or full-blown stroke. And because there's a decrease or stoppage of the blood to the brain itself dies. Some symptoms is, like I said earlier, you have the pain in the center of your chest. Some people refer to it as an elephant that's sitting in my chest. Persistent pain in the left and right arm, shortness of breath, the swelling of your feet, legs, feeling tired, loss of appetite. Those are commonly found in patients with congestive heart failure. The good thing about it is treatment for coronary artery disease. Exercise is one of the treatments. Exercise is an essential part of heart treatment. Exercising regularly lowers blood pressure and cholesterol. It lowers cholesterol by allowing your body to metabolize it more effectively, burning it off. Excess weight means that your body has to work harder. A diet low in fat. Eat less fat. Relieve stress. Try not to be stressed. They have what you call angioplasty, stent, or you could do the coronary artery bypass surgery. You want to keep your cholesterol levels low. Your LDL shouldn't be higher than 100 milligrams per deciliter, and your HDL, your good, should be greater than 40. Too much cholesterol can lead to arteriosclerosis, which is the number one cause of coronary artery disease. And arteriosclerosis, which is an abnormal inflammatory process inside the artery walls as a result of complex interactions among bad cholesterol, your LDL, platelets, calcium, and inflammatory cells. It's certain factors like obesity, sedentary lifestyle, smoking. Those factors also contribute to having arteriosclerosis. If you think you've had a heart attack, you need to go to the emergency room immediately. Some people take 2 aspirins crushed and go head on, because once you get to the hospital, they're going to start you on a clot buster or thrombolytics to break down the clots, and you have a better chance of survival if you go head on. Coronary artery disease is the leading killer of both men and women throughout the world. Arteriosclerosis is the underlying cause of CAD and heart attacks. It's a complex inflammatory reaction that damages arteries throughout the body. Thanks to sedentary lifestyles and fat-laden American diets, arteriosclerosis now commonly begins in kids as young as 12 or 13. Take charge of your life by taking charge of your arteries. Make health a priority and keep your heart defense strong. Preventing heart disease is the best form of treatment. I would like to reference the 2 books, which is Heart Smart, and it's by Dr. Matthew S. Devane, and the other one is The Heart of Matter by Hilton M. Hudson II and Herbert Stern, PhD. Thank you. You guys have a nice day.